Hi there, are you Anne?
Yes.
My name's Lydia. I'm a level one student nurse, and I'm going to meet with you with this patient today. Can you give me an SBAR report?
Okay. So I have patient in room 622. His name is Ronald Jarvis. He is 67 years old male. He's assigned to Dr. Phillips. He has no allergies. He is full cold, and he's on special diet. 1800 calorie diabetic with 2 grams sodium restriction. His primary diagnosis is stage 2 diabetic, also on the right heel, and secondary diagnosis is diabetic type 1. So he was complaining of increased blood sugar reading for the past 5 days with results consistently in the 300s. He also reported a new lesion on the right heel, which he first noticed about 3 weeks ago, and he said that it's not healing and it has become increasingly painful. So he tried soaking his foot in the salt water, but it didn't provide any relief. And so the patient diagnosed with diabetic type 1 about 20 years ago, and he has been insulin dependent since then. Until 3 weeks ago, patient running consistent blood glucose in the 120 range. His last A1C check was 3 months ago, and it was 5.2%. Patient states he has a family history of father passed away of myocardial infarction at age 53, and his mother died of lung cancer at age 78. And he also has a transurethral prostate resection 5 years ago, and he usually drinks 16 ounces of beer each Friday evening while bowling. Patient report his weight has been consistent. It's at 170 pounds, and he denied any recent weight loss or weight gain. His visual is 20/20, both eyes with glasses. He denied any difficulty with hearing. So his last vital sign was taken at 16:45. The temperature was 98.4. Respiration was 16. Heart rate was 76. Blood pressure was 128/70. O2 stat was 96%. He has a pain level of 1 on the scale 0 to 10. And I also noticed some abnormal labs. His red blood cell was low, 4.5. Hematocrit was low, 41.2. Calcium was low, 7.4, and ALT was high, which was 38. So he was alert, awake, and oriented time 4. His speech is clear, gait is steady. People are equal, round, and reactive to late extraocular movement intact, mouth moist without ulcer. His skin is dry and intact except for stage 2 ulcer on the right heel. The wound is 5.5 centimeter and 2.5 centimeter at the larger diameter, and about 3 centimeter deep extending to the dermis. The wound base is pink, no tunneling or undermining note, moderate serosanguinous exudate. For respiration, his lungs are clear to auscultate in all lobes. Breathing unlabeled without accessory muscle used. When I listened to his heart sound, I heard S1 and S2 without murmur. Regular rate and RAM, no carotid bloated, and no edema. For his abdomen, it was flat, symmetrical, and soft, no tenderness. I heard active bowel sounds in 4 quadrants, no bruit present, no ascites. He has 5/5 muscle strength in all extremities, no clubbing, cyanosis. Patient also has a peripheral IV with 20 gauge in his right arm. So his last accurate was at 20:30, and it was 2:42. So I have some medication ready for him. right now. Do you have any more questions?
Yes, actually. Why specifically is this client receiving this medication?
So patient is type 1 diabetic. He's insulin dependent because his body produces lack of insulin.
Okay, and what action does this medication have on the body?
It decreases his blood glucose level, and it also help the cells to take in glucose and to be used for energy.
And when should you question administering this medication?
So I will check his blood glucose level, make sure it's not too low or below 70.
And does the medication have a therapeutic serum level?
Yes, the normal blood glucose level is 70 to 100, and his glucose level was high, so we want to make sure he got the insulin to bring the sugar down.
Okay, and which vital signs must be monitored?
So we want to monitor all the vital signs, but especially respiration, heart rate, blood pressure, and make sure we check his blood glucose level.
And which physiological parameters should be monitored when the medication is being administered?
So we want to make sure he recognize and know the signs and symptoms of hypoglycemia. And some allergic reaction, maybe such as itching, breathing problem, or rash, or something like that.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So in the hospital, we want to make sure we cleanse the area before we inject and rotate the injection site. Make sure we use our proper techniques.
And what interventions must be taught for taking the medication safely at home?
So at home, he always want to make sure he check his blood sugar before he inject himself. And he will store his use insulin at the room temperature, and it only lasts for 28 days. So after that, he will discard the medication, and he know to store the unused medication in the refrigerator, and make sure he rotate the injection size, use the same needle, and do not skip meal, because if he administer insulin while glucose is not available, can lead to hypoglycemia and possibly coma.
Okay. And what are the side effects and the potential adverse reactions?
So the main side effect of insulin is hypoglycemia. So he may feel dizziness, confusion, sweating. So make sure he doesn't have any problem.
Okay. And how will you know the medication is effective?
So when his blood sugar is within normal range.
All right.
Do you have any more questions?
I think that's it.
Okay, you ready to come in?
Sure.
Knock, knock, knock.
Does this information affect how you administer the medication?
We would have rotated the site to perfect everyone's conforming.
My name is Anna. I'm your nurse today, and I have
Units would have been adjusted.
the medication ready for you.
Okay.
How you feeling?
Thank you so much.
Okay. I'm gonna wash my hand.
I don't know if I got like 100 things.
I'm gonna raise your back up, okay?
Okay.
Can you verify your name and date of birth for me, please?
Yes, my name is Ronald Jarvis. My birthday is May 5th, 49.
Okay, thank you. Do you have any allergy?
No,
Are you having any pain right now?
not at all.
Okay, so we won't give the morphine sulfate. So I have insulin glargine, and insulin regular to be administering for you right now. Do you know what is it for?
For my blood glucose levels.
Okay. Do you know any side effects of it? Okay. So the main side effect will be hypoglycemia, which is confusion, and you may feel sweating, dizziness,
Okay.
lightheadedness, something like that. So make sure you don't have any of those happening. So I also print out a hard copy for you to read.
Okay.
Do you need a few minutes? Okay, let's do that. Okay, as long as we leave out of here, wonderful, good. You know what, I had to do, like, clear the whole phone out, that's why I didn't have your number on there. And I could have cleared out all the
So I have the doctor order for insulin glargine 18 units subcutaneous.
Okay.
Yeah, I'll post it and then I'll send it.
First, we want to inject 18 units of air. So before we administering, always want to make sure we check it's the right medication, right dose, right round, right patient, right time. So it is. So now I'm gonna scan the medication.
That's my grandmother's name, Marie.
There you go.
Yes, I can hold it.
Inject 18 units of air. Now withdraw 18 units.
Where do I find it, where we should go?
Go into vital. So when is the last time they give you your medication? Was it on the stomach?
Yeah, I was on the right side.
On the right side? So you want to do it on the left side today?
Mhm.
Okay. So I always cleanse the area. Subcutaneous 90 degree. Are you okay?
Yeah, I'm doing good.
See this blood glucose.
It's on the vital.
Oh, oh my goodness. I'm terrible. Okay.
I'm gonna go ahead and document that you take your medication, okay?
Okay.
Now, are you ready for your insulin regular?
Yeah.
Put on the clock again. Can you tell me your name and date of birth again, please?
Ronald Jarvis, May 5th, 49.
Thank you. And you said you don't have any allergy, right?
No.
So want to make sure again, check the medication, is insulin regular, giving to the right patient, right time, right dose, right route.
Can I ask you for the spot? Right here we have, Greg, who is taking 67 now, to the nursing home, and then after control care. He's in stage 21. He's at middle or stage 2 diabetic also, with a secondary diagnosis of diabetes. Patient went to the doctor's office, and he had increased blood
So your
glucose
last
readings.
accurate check was 242, and on the rating scale,
Right heel. And he noticed these,
when you the blood sugar from 241 to 300, so we will give 16 units of insulin for you today. Okay.
he has ALS history. He reports a new lesion on his right heel that made it 5.5
Inject six. So you want to inject 16 units of air?
Maybe no dressing on at this time, it's open to air. We're gonna wait till wound care is gone in the morning, we'll take a look at it. Assess and tell dressing. He noticed the
Now withdraw 16
lesion 5
units.
weeks ago. He said it's not healed, but it's becoming increasingly painful. He did try soaking his foot in some salt water at home without needing it. He had mixed septal and bilateral eye extremities, which had seemed to worsen in the past 2 weeks. As one is still present, no further issue that he didn't have any testing or complications. The respiratory problems, sounds are clear. He has normal ultrasound sounds. He has no issues at this time.
Cleanse the area again.
Around 242. No significant findings at this time. He has the IV at the right hand. The vital signs are temperature.
You ready? 90 degrees subcutaneous again.
95% of room air. Blood pressure is 145 over
How you
70.
feeling?
Good.
First one is 16. Last time we checked this pain level is 1. That's good. That's listening. He has consult to wound care has been placed.
Document that you take the
Also,
medication.
he followed the 1800 American diabetic nutrition diet over the past 9 months. And he got up to education. Any other questions?
Yes, especially this client received this medication.
He received this medication because he was diabetic and also because of the blood
What action does the medication have on the body?
This medication always is a concentration of explosive quicker glucose and muscle tissues and high glucose production. The NPH is an intermediate insulin that and the regular insulin is a short-acting insulin.
So before I leave the room, can you tell me
Depression and during this
2 of the side effects you may have?
Confusion and sweating.
Okay, yes. Just let me know if you have any signs and symptoms of that, okay?
Okay.
Do you have any question for me?
Mm-mm.
Okay, so I'm gonna lower your bed. And here's your colleague, just call me if you need anything, okay?
Okay.
Thank you. You want me to close the door for you?
Yeah, that's fine.
Physiological parameter should we monitor when the medication is being and what
Did you like it?
Yeah,
Do you have any more questions for me?
I do actually. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes. So I wanna make sure follow the 5 rights: right patient, right drug, right dose, right time, right route, and the patient has the right to refuse the medication.
Okay.
One more thing. So for glargine, you want to make sure you administer same time each day, and insulin 30 to 60 minutes before meal.
Okay. And did this information affect your decision to administer the medication?
Yes. So when I check his blood sugar, if it's below 70 or below the normal range, I should not give it to him. And make sure. I think that's it.
Okay.
Yeah.
All right. And I think that's it. All I have. All right.
Thank you.
Mhm.